success in life? It's not for those who run fast, but for those who keep running and always on the move. Success in life is not for those who run fast, but for those who keep running and always on the move. Good afternoon, good morning, good evening, good time, bon après-midi. From wherever you are tuning from, you are tuning to Youth Avenue, the Lunchtime Show, which seeks to inform, educate everyone out there, especially the youth. Today it's Thursday, the 29th day in the month of October in the year 2020. Time check, 39 minutes past 12. And my name is Laina Eko, your host this afternoon. Do me a favor when you tune in. Share, start a watch party. Let's educate everyone out there. Remember, Youth Avenue is brought to you by Royal Media College, School of Journalism, Media Studies and Languages. Royal Media College is located at Kwashiman opposite the Happy Kids School. Royal Media College offer courses like media and journalism, under which they have radio and TV presentation, sports presentation, camera handling, graphic designing, photography, sound and video editing, DJing, and many more. Anything journalistic, I recommend Royal Media College for you because it's the best media school in GH with the best ultra-modern facilities, best lecturers to impart into your world, affordable fees and flexible terms of payment. The best opportunity you can get is Royal Media College. You can call Royal Media College on 0244 611 055, 0244 611 055 or 02756 11055. You can pick up a form at the office at Kwashiman opposite the Happy Kids School, or you can download online at www.royalmediacollegegh.com for further information. Thank you if you just joined, if you just tuned in. This is Youth Avenue, the Lunchtime Show. I hope your day is going well. Like we say all the time, there is a breaking news, and the breaking news is that we must say thank you to our Maker. So wherever you are, it is not too late to say thank you to Him if you've not done so. Let's do it together. So God, we are saying thank you to you for the gift of life. It's a privilege to be part of the living. As usual on Youth Avenue, we bring you segments, the motivational segments, the health segments, the discussion segments, and the letters to Now segment. It's always educative, informative, and entertaining. So do join us always. Stay, don't go anywhere. It's going to be informative, it's going to be educative. Do me a favor, it is very important. You can watch us live on Facebook at Premier FM Ghana, YouTube Premier FM Ghana, or you can listen on our online radio boards at Premier FM Ghana. Do me a favor, this is the most important thing. Share to all youth platforms. Let us start a watch party so that we can educate the world. So yesterday we looked at breast cancer. Since we are still in the breast cancer month, October, breast cancer month, the pink October. So let's educate ourselves about breast cancer. The general consensus is that it is only women who experience breast cancer. But let me educate you. Just this week, I think there is this interview circulating on social media. A man has developed breast cancer. I'm telling you. And when they interviewed him, he was like, he doesn't have breast. Into breast cancer, but when you be, so men out there, you need to also examine, go and check your breast. And there is something there. You can also develop breast cancer. So let's educate ourselves. It's not only women. Yes, women are prone to get it, but men as well can also get breast cancer. So we are educating everyone. If you're a man, a lady, a woman, a guy, you need to go and check. We are still in the breast cancer month. So we looked at what breast cancer is. Today we are looking at diagnosing breast cancer. Before you can tell someone that you have breast cancer, they need to diagnose you first. And let's see the diagnosing breast cancer. It says tests and procedures used to diagnose breast cancer include breast exam. Your doctor will check both of your breasts in your armpits, feeling for any lumps or other abnormalities. So like this. In that order. That is how it is done. Just recently, they organized a breast screening at my church, Macedonia Methodist Church. But some of the young ladies are actually afraid to go because they will touch their breast. Like really, I have someone here who was very scared. She was afraid to go and check. My friend, please. Dr. Bikache me say, "Oh, ferry unhu uyaria, unya unwedru." Ladies, we should stop fearing and go and examine our breasts. We have mammogram. I hope I had it right. Mammogram. A mammogram is an X-ray of the breast. Mammograms are commonly used to screen for breast cancer. If an abnormality is detected on a screening mammogram, your doctor may recommend a diagnostic mammogram to further elevate or evaluate the abnormality. And we have breast ultrasound. Ultrasound uses sound waves to produce images of structures deep within the body. Ultrasound may be used to determine whether a new breast lump is a solid mass or a fluid-filled site. And the last one, we have removing a sample of breast cells for testing. And this is the only definitive way to make a diagnosis of breast cancer. During the diagnosis, your doctor uses a specialized needle device guided by X-ray or another imaging test to extract a coil of tissue from the suspicious area. Often, a small mental marker is left at the site within your breast, so the area can easily identify on the future imaging test. So these are a few diagnostic process to determine whether you've developed breast cancer or not. Now let's look at the staging in breast cancer. Once your doctor has diagnosed your breast cancer, he or she works to establish the extent, that is the stage of your cancer. So your cancer stage helps determine your prognosis and the best treatment options. Complete information about your cancer stage may not be available until after undergo breast cancer surgery. And these are the tests and procedures used to stage breast cancer. We have the blood tests, such as a complete blood count, the mammogram of the other breast to look for signs of cancer, breast MRI, then bone scan, computerized tomography, CT scan, and positron emission tomography (PET scan. So that's how they stage breast cancer. Good afternoon to you guys, Richard, Azimi Richard, and Margaret Williams. Nana Kwesi Akum, God bless you. Nana Kwesi says, whoa, you look beautiful this afternoon, Papa. Keep on doing a great job, lovely program. Thank you, Nana Kwesi. Thank you, Margaret Williams. And thank you, Richard Azimi. I hope I had your name right. Let's look at how to treat breast cancer. The doctor determines your breast cancer treatment options based on your type of breast cancer. So before they treat the breast cancer, they need to determine the type of the breast cancer, the stage, the grade size, and whether the cancer cells are sensitive to hormones. So we don't just treat breast cancer, but they look at determined factors: the size of the cancer, the stage. Most women undergo surgery for breast cancer, and many also receive additional treatment after surgery. So yeah, these are few ways to treat breast cancer. Don't just go and say treat my breast cancer, but the doctor needs to determine a lot of things, to look at a lot of factors: the size of it, the stage, and the whole lot. Since we are still in the month of breast cancer month, we are creating the awareness that every young lady, every young individual, both men as well, should go and examine your breast. Do me a favor, share if you just tune in. This is Youth Avenue, the Lunchtime Show, here in the studios of Premier FM. Do me a favor, start a watch party. Let's educate everyone out there, especially the youth. Youth Avenue, the youth are concerned. Thanks for the contributions, the comments, the likes, the shares. So far, we appreciate you. Remember, you can watch us on Facebook at Premier FM Ghana. If you're not on Facebook or your friend is not on Facebook, you can watch us on YouTube as well at Premier FM Ghana. Subscribe, like, and share. You can listen online on the online radio box at Premier FM Ghana. Do send your comments, like, tell a friend to tell a friend that Youth Avenue is live. Time check, 51 minutes past 12. And today is Thursday, a beautiful one, a lovely Thursday. The 29th day in the month of October in the year 2020. And my name once again is Lion Ayoko, God's own, God's favorite. And you are listening to the best talk show in GH. Remember, if you want to sponsor Youth Avenue or any other program on Premier FM, you can call Premier FM on 0244-627930, 0244-627930, or 0244-627931. For all your advertisement needs, come on board. Let's grow the brand together. We'll advertise your products. We'll deliver. We'll meet your expectations. The best online radio so far. Quality is assured. So that's it for our health segment today. I hope from here you are going to have your breast examined. Personally, I hope you are going to do yours. Because from here I'm going to do, because I was also part of the people who scared. I didn't want anybody. You see the thing. Erica, if not, then all of us from here, we are going to Ebenezer, my DJ, all of us, we are going to have our breast examined. My DJ is like, what? I'm telling you, you watch the social media, you see the man with the breast cancer. Also, no, only no funte. How? It's just cancer, be there. It's just cancer. It's not breast cancer. But that is what the information is, that it's breast cancer. And you could see the breast swollen, like it, yes, with nipple and all that. I'll get the image for you tomorrow so that you can attest to it. You think I'm just lying? Moving on to our motivational segment. Everyone needs to be motivated. And so therefore, Real T. Bennett says that guard well your thoughts when alone and your words when accompanied. Guard well your thoughts when alone. Guard your thoughts when you're alone. And your words when you're accompanied by people. So guard your thoughts when you're alone. And your words when you are with people. That's wisdom. You. Scotch Lane says that quit being so hard on yourself. We are what we are. We love what we love. We don't need to justify it to anyone, not even to yourself. So quit being so hard on yourself. We are what we are. We love what we love. We don't need to justify it to anyone, not even to yourself. I hope you've been inspired. Don't be so hard on yourself. You are who you are. We are what we are. We love what we love. You don't need to justify yourself to anyone. Be motivated this afternoon. Do me a favor, let's share. Today on our program, the topic for discussion is abortion. Do you have a legal way of aborting pregnancy? Is it illegal to abort pregnancy? If it's illegal, when you do it, do you get arrested for it? Are there spiritual, physical implications with abortions? Is abortion the right option for anyone? The people who abort pregnancies, are they happy after doing that? Let's hear your views, your thoughts on the topic for discussion this afternoon. Let's get interactive, be part of us. We'll gladly read the comments, the contributions here in the studios. So let's get interactive. Time check, 56 minutes past 12. And today is Thursday, 29th day in the month of October in the year 2020. Share the page. Yesterday I asked you a question. So today I'm taking my answers from my producer, my panelists, everyone here, even my online manager, my DJ. I asked you guys a question, and to you, our viewers, I'm taking my answers. If you've forgotten the question, and then because you show teacher now, what about if you say with you, Mama matching, and then yes, I country for no. And to Montreal, Mama, okay. So we are going all out for our viewers. Some of you want the local language, so pardon us. We'll try to blend them. Mi mama habium. Mi jidi se mode no ekoye. Governor Frimpong, I've missed you so much. In fact, if you do that again, I'll take you to court. It's been a while, yes indeed. Yes, I'm doing well by the grace. Hope you are doing well as well. Enjoy this music as we go on the musical break. When we come back, stay tuned. It's going to be our discussion segment where we'll look at abortion. Is it legal? Is it illegal? The implications. Stay tuned. It's going to be massive. It's going to be educative. It's going to be informative. I'm telling you, because we are bringing in the experts. Stay tuned. Enjoy this music. just tuned in, this is Youth Avenue. The lunchtime show with 6 to educate, inform and entertain everyone out there, especially the youth. Youth Avenue, the youth are concerned. Do me a favor. If you are tuned in, this is the best talk show in GH. Do me a favor, share, like, start a watch party. Okay, Kwabena, I'm not going to take you to court. In fact, okay, Kwabena says that I'm looking beautiful. Really? Your outfit is nice. Abortion is distasteful. Then you, the guys, make sure you take responsibility when you impregnate the ladies. My dear Kwabena, no more about no. Because when they tell you take responsibilities, they won't go in for abortion. Welcome once again from wherever you are tuning from. A good afternoon to you. A good morning, good evening, if you are from different countries. This is Youth Avenue, the lunchtime show here on Premier FM Ghana. Remember, you can watch us live on Facebook at Premier FM Ghana. Premier FM, power to the nation. You can watch us on YouTube as well. So don't worry if you are not on Facebook. You can watch Youth Avenue live on YouTube at Premier FM. You can listen online on the online radio box at Premier FM Ghana. So like I said, today we are looking at abortion. Is it illegal to abort pregnancy? What are some of the factors why young ladies abort pregnancy or terminate? Sigismond, today Sigismond is live with us. Hello, dear. Says that, dear, you are looking sweet. Thank you. Some of these comments, you should attach envelope. Alright, so before we take our phone interview with an expert, we'll go for a quick commercial break. When we come back, the discussion segment continues. Stay tuned.
Radio, TV, and newspaper Royal Media College and King of Kings World Foundation and Angel TV. Momo Maria JHS, SHS, Empo University for 75% free scholarship at Royal Media College where your radio, TV station, and the recording studio at the chat is to American before admission for a school office. See, your hostel, more featuring you now. Some baby ada. Na yen courses are journalism and media studies. A radio and TV news reading, program hosting, DJing, and sports presenting. And the editors also be sound engineering, video and photo editing, camera handling, directing and script writing, business marketing, advertising, graphic designing, and ahudo bebre. Ghana Education Service ne ICM for more England at J2. Shishe chira kwa Kwashiman traffic light. The ne happy kids school down in the Dinshe ni Accra. Trayan waya homa trophy 0244 611 055 or 0275 611 055. Yawabe Fontaine Video www.royalmediacollegegh.Royal Media College, raising quality journalists and media professionals. Royal Media College. Yemawoda Son Ebem. Welcome to Royal Media College, where becoming a media professional has just become easier and better. Are you a JHS leaver, SHS, or a university graduate who has passion for the media? Pass or fail. Royal Media College and King of Kings World Foundation, in partnership with Angel TV, is giving 75% free scholarship. Just grab your admission form in our school's office. We have state-of-the-art studios for our students to learn practically. We also have experienced lecturers and student-friendly learning environment. Choose Royal Media College as your school and select from our wide range of courses like journalism and media studies, under which we have radio and TV news reading, program hosting, DJing, and sports presenting. Other professional courses like sound engineering, video and photo editing, camera handling, directing and script writing, business marketing, advertising, graphic design, and many more. We are certified and approved by Ghana Education Service, also affiliate to ICM England. Locate us at Kwashiman Traffic Light, opposite the Happy Kids School main building. Call us on telephone numbers 0244 611 055. King of Kings World Foundation and Agile TV. Momo Maria JHS, SHS, Empo University for 75% free scholarship akwenya so mo de besua de. Royal Media College where your radio, TV station and the recording studio e digital desua for nyina de. To Americana be for admission form e where your school office. See ya wadabre ye hostel mo fie kire nyina. So mo benya baabi ada. Na ye courses aye kire na ebi journalism and media studies. Ebi nso e ka ho radio and TV news reading, program hosting, DJing and sports presenting. And the
Welcome back. It's the Youth Avenue, the Lunchtime Show. We seek to educate, inform, and entertain everyone out there, especially the youth. They can stay, don't go anywhere. We are zooming into our discussion segment with a senior staff midwife who is going to educate us on abortion. Everything that we need to know about abortion. Take a stay. Hello, good afternoon. Hello, good afternoon.
Hello, good afternoon.
Welcome, Mrs. Belinda Nyame.
Thank you.
Great to have you, and you're welcome to Premier Left from the Youth Avenue Show.
Thank you.
Okay, so if you are ready, we are ready. We want to be informed and be educated on abortion since you are the expert.
Okay.
All right.
So I will once again greet your listeners. Good afternoon, listeners.
Hello.
Today we are going to talk about abortion. We know in Ghana when we see somebody has had an abortion, we think the person is behind it or the person took a medication to abort the baby. But abortion is a broad term. And I'm hoping that after the discussion, we'll understand whatever entails in abortion. So when we say abortion, it is the loss of pregnancy before the fetus is capable of extrauterine life, or it is the expulsion of fetus or the product of conception before the 28 weeks of pregnancy. We know we are supposed to carry pregnancy for 9 months or for 40 weeks, that is 10 months. So if you deliver or you expose the baby before the 10 weeks of pregnancy, then it means you have aborted. And the service, immediately you get pregnant, the service is supposed to close for the pregnancy to continue. But with abortion, the cervix opens before the due date. So when you lose pregnancy before the baby survives outside the uterus, or you lose pregnancy before the baby is 7 months old, then it means you have had an abortion.
Okay.
So there are types of abortion, 2 major types. 1, spontaneous abortion. With a spontaneous abortion, it means that there was no one behind it. It just happened due to a few reasons. And under the spontaneous, we have types.
Okay.
We have threatened abortion. So with a threatened abortion, it means there's a potential of you losing the baby. But the good news is that the cervix remains closed and there is minimal bleeding. So if you have bed rest and you take a few medications, you'll be fine. The pregnancy can continue to term.
Okay.
So it means there was a potential of you losing the baby, but the abortion didn't happen. So with bed rest, you are safe that the pregnancy can continue.
Okay.
Then we have another one, which is the inevitable abortion. Inevitable means that the baby has been aborted. There is nothing you can do to continue with the pregnancy. And with the inevitable, there are other subtypes. We have the complete. This means that all the products of conception have been aborted completely. And with this, there is heavy bleeding. You can see visible parts of the fetus in the bleeding. And the cervix is usually closed, means everything has passed out. And there is less pain because everything has been moved out of the uterus. That is with the complete.
Okay.
And with the incomplete, parts of the product of conception have been aborted and other parts have been retained inside. And usually the cervix is dilated, meaning there's part of the products of conception inside the uterus. And there's also visible bleeding. Then signs of shock, like the person becomes restless, the pupils dilate and so on. So under the inevitable, we have the complete and incomplete. Am I clear with that?
Yes, we are.
Okay. So there is another side, which is the missed abortion. With the missed abortion, the products of conception are not expelled, but the fetus is dead inside the uterus. With other types of abortion, you can see the visible product outside. But with the missed abortion, the fetus is dead inside.
Okay.
And there's reversal of the symptoms of pregnancy. You no more feel dizzy. You no more feel like you are pregnant. And the uterus is smaller than the number of gestational age at which you are pregnant. So if you are 4 months, it is lesser. The size of the uterus is lesser than 4 months. So with the missed abortion, you will not see the visible parts of the fetus, or you will not see bleeding, but the child is died. The fetus has died inside the uterus.
I see.
So the first major one is the spontaneous. That is what I just exhausted. So we have threatened abortion under spontaneous. We have inevitable under spontaneous, and we have missed under spontaneous.
Okay.
So the second one is induced abortion. Induced means someone is behind the termination of the abortion. So with the induced, we have two types. We have therapeutic, legal or safe abortion. So with this one, the procedure is done by a skilled personnel in an approved environment and under hygienic conditions using all the medical standards. With the therapeutic abortion or safe abortion, it is done by a skilled personnel in an approved environment under hygienic conditions or using the medical standards. And with the criminal abortion, it is done by an unskilled personnel in an unapproved environment, lacking minimal or no medical standards. Please, am I clear?
Yes, you are.
Okay, so I'm done with the two types.
Okay, before you continue with the other, I want to know with the legal one, which is done under safe environments at the clinic.
Okay.
Do you seek parental consent before doing or performing an abortion?
Okay, with the minors, we are supposed to seek parental consent, not compulsory. You should ask the client first. If she wants you to speak to the parents, it's fine. Other than that, you can't deny her of the medical services. But there is something known as the local parents. She can refer you to someone she trusts in or she can confide in. The person should be above 20 years. It can be a co-tenant, a neighbor, or a friend, a close friend. It is not compulsory to tell the parents. Yes, confidentiality is very important. If the client tells you, I don't want my parents to know, you are not in any position to deny the person of the abortion or the medical services. But you can encourage the client to either tell the parents or look for someone who she can confide in or is very closer to. That is the local parents I was talking about.
So from what you said, it is our right to have a medical to experience medical services. Okay, so it means that at any point, if anyone should come to the hospital and says that I want to terminate this pregnancy, there's nothing like you are going to seek consent or we are going to deny you that.
No. Abortion is only legal in Ghana under certain conditions. If the person meets all the conditions and the person doesn't want the parents to know, you have no part to play by telling anybody. You have to respect the person's decision.
Interesting. Okay.
And then do what is needed.
Interesting. And you can move on, please.
Okay. So is abortion legal in Ghana? People may ask. Okay. So before 1985, it was illegal. And then there was amendments in the law. And then it was accepted that abortion should be legal in Ghana under certain specific conditions. So if you miss any one of the conditions, it means it is illegal.
I see.
So here are the conditions.
Okay.
1, who can perform the legal abortion?
Who can perform?
So it should be, hello?
Yes, we can hear you.
Okay. So it should be a registered medical practitioner specialized in gynecology. Gynecology is the study of the female pelvis and everything related to females. So if you don't have any idea concerning gynecology, you can't practice abortion. So it should be someone registered and specialized in gynecology. Then 2, any other medical practitioner trained in abortion, example, midwives. So any person other than these 2 cannot perform abortion in Ghana and term it legal.
Really?
Hello?
Yes, hello, Belinda, you're online.
Yeah, okay. So the next condition, where can the abortion be performed? 1, every government hospital, provided there are special medical people specialized in abortion or gynecology. So every government hospital in Ghana. And then 2, private hospitals and clinics registered under the Private Hospital and Maternity Home Act 1958. And then places approved by the Ministry of Health or by a legislative instrument. So there are special places which are being registered by the Ghana Health Service or Ministry of Health. They can practice abortion. Then we have PPAG, Planned Parenthood Association of Ghana. They are groups of people who are specialized in family planning, adolescent health, and then reproductive health issues. So PPAG, any PPAG branch in Ghana performs an abortion. And then Mary Stopes Clinic, they are a foreign NGO who practice family planning as well, and then abortion, safe abortion. So these are the places you can have a safe abortion, and we can term them as legal. Then the third condition is the legal indications for the abortion. So when someone comes to you, you have to pass the person through all these indications. If the person meets this indication, then it means the person is qualified to have an abortion. So the first one is risk to life or injury to physical or mental health of the woman. So the person comes to you, the person is pregnant, but the BP keeps rising, or keeping the pregnancy might end the woman's life. Then it means you can help the woman have an abortion if she wants or she insists of having an abortion. Then the second one is rape, incest, defilement of a female idiot. So if somebody has been raped and the person opts for abortion, you have no case to deny the person the abortion. Then incest. Then defilement of a female idiot. A female idiot is like a mentally challenged woman. Yes. So with this, you can offer the abortion and it is legal.
Okay.
Then the next is substantial risk that the fetus has or will have serious abnormality or disease. So somebody can take a scan and the scan can detect the child has no limbs, the child has no, so many complications and abnormalities. So with this, the person can opt for an abortion because she's thinking of maybe going through this stigma and stress.
Yeah.
She will opt for abortion, and you have no right to deny the woman. You will have to perform the abortion for her.
Okay.
So these are the conditions, the 3 conditions that makes abortion legal in Ghana.
Okay. All right. Okay.
So the first one, who performs the legal abortion?
Mm-hmm.
The second one, where can the abortion be performed?
Mm-hmm.
And then the third one, the indications to which you perform the abortion.
But with the who can perform the abortion, you mentioned 2 specific people, which I think that there are a lot of people performing abortion on a lot of women, and it is not so.
That is why.
Isn't law? It's not law abiding. They are not being.
No. If the person is a medical personnel and has been trained in gynecology or the abortion, the person is safe. But most people do it on the job. Maybe the person has experienced someone doing it and has mastered, but has not been trained.
Okay.
When you are trained, you are given certificates. You go through a whole lot before you are being accepted as you can perform abortion.
Okay.
So people do it. The pharmacists, other people do it. So me, for instance, I'm a midwife. I've been given the chance to perform an abortion, but I can't take the person to my room to perform. Do you understand?
Okay.
It should be in an approved environment.
Okay.
Okay. So you should meet all the 3 conditions before it is termed as legal.
Okay. All right.
Okay.
Let me read a few comments before you continue, Belinda, please.
Okay.
So Oyinba Sempa says that, hey, today you are educating us on more fire. Okay. Bennett Techi texts with a clap emoji. And okay, Bennett Techi says that I should ask if the fellow 2 would sign a consent from a consent form before the procedure?
Okay. Yes, there is a consent form we sign. The person is supposed to sign a consent form before the procedure is started or admitted. Hello?
Hello, Belinda, I can hear you. You're online.
Yes. Should I continue?
Yes, please, you can.
Okay, so why do women choose to abort? So maybe the first reason is socioeconomic reasons. The high standard of living. Maybe the woman already has 5 or 6 children. She's finding it difficult to cater for them. So immediately she conceives, it comes to mind that let me abort this pregnancy, otherwise I can't continue with life, or continue with this pregnancy is going to give me a whole lot of stress. So these are one of the reasons, socioeconomic reasons, high standard of living. Then contraception failure. The person took in a family planning method or contraception, then it failed. Then she got pregnant. So this is one reason they abort. And then family planning services inaccessible. Maybe the person, the area the person is, she has no access to these family planning services. So she gets pregnant, and then the next option is to abort.
Okay.
The stigma, especially with the lactation mothers, the person just delivered within 6 months, she's pregnant again. She's afraid of the stigma. Hey, so facing this stigma causes them to have abortion and then be free. Then fetal malformations. When you take a scan and then they tell you your child has no limbs, the brain is malfunctioning, then the person will opt for abortion rather than giving birth to this child. Then rape or sexual abuse. When people are raped and then they get pregnant, they decide to abort rather than keeping the baby because of the stigma attached to them. Then partner pressure. The man or the spouse the person is living with doesn't want the baby, then gives the woman pressure to go and abort. So this is one main reason why people abort. Okay. So we are going to the causes, some of the causes of abortion.
Belinda, please, before you go to the causes, let me ask this question. What about those who buy the pill and perform at home? Is it legal as well to be?
It is illegal. In fact, the medication used is not supposed to be sold over the counter, because they take huge sums of money and then give it to them. They don't even think of it twice or something, so they just give it to them. But it's not good, because you are supposed to be monitored after you take some medications and the rest. And people use a whole lot.
Okay, all right.
And it depends on the weeks for which you are pregnant. Some weeks are there, you shouldn't even venture. Okay. But because they are desperate, they go in for pharmacy drugs.
Okay. All right, we have another question, but you go to the courses, then I'll pick the question from our viewers online. Okay, so we can go to the courses now.
Okay, so causes of abortion. So infections such as malaria and UTI. When you are pregnant and you have malaria and UTI, the infection with the UTI, for instance, UTI is urinary tract infection. Urinary tract infection. Okay. So the infection travels up to the cervix. The cervix holds or is the neck of the uterus. So when there is an infection there, it tends to open, but it shouldn't open till you are 9 months, 10 months to deliver. Okay. So when the infection travels there, it causes the cervix to naturally open, and then the baby comes out as an abortion. Then exposure to radiations or toxic agents. We know some of women work in these companies with exposure to radiations and then exposure to toxic agents. So this in turn causes, when they are being exposed to these radiations, it causes the child to break down. Like meanwhile is blood. When you take seed, the child becomes blood before it forms into human. So any exposure to the radiations causes the baby to pass out as blood, which is termed as the abortion. Then conditions of the cervix. There are certain cervix that cannot hold pregnancy. Example, incompetent cervix. Incompetent cervix means their cervix cannot close. So throughout the pregnancy, you are supposed to lie for them to suture the cervix before you can carry the pregnancy to term. Okay. So if you do not notice this condition, and then you carry every pregnancy and you walk about as any normal person, the pregnancy can just pass away, or you might just expose your baby. Then trauma or falls. If you fall, the uterus or the cervix slightly opens and then the baby comes out as an abortion. The lifestyle factors, smoking, alcohol, the nicotine in smoking causes uterine contractions. So in labor, you're supposed to have contractions before the baby comes out. But since you smoke, it is not time for you to have the baby, but the uterus gets this severe contractions and then the baby comes out as the abortion you're talking about. Then medications and douches. As a pregnant woman, you shouldn't be buying over-the-counter drugs. Whenever you are sick, you're supposed to visit the hospital because some medications destroy or causes the baby to come out or causes the cervix to open naturally. So you're not supposed to buy any medications outside if you are sick or if you're a pregnant woman. You're supposed to go to the hospital for the necessary medications to be given to you rather than going to the pharmacy to get any drug of your choice. So these are the common causes.
Okay.
Yes.
Before you continue, my sister who was pregnant, anytime she was experiencing like tiredness or she wasn't feeling well, she would be like, pregnant women are not supposed to be taking drugs, just any drugs. No, you need to enjoy it. How true is that? Or you need to visit the hospital before they prescribe this medicine. You can't just go to the counter and buy, okay, I'm feeling
No.
Okay.
You're supposed to go to the hospital. There are certain medications pregnant women are not supposed to take. So when you go to the hospital, they prescribe the right drugs for you. That one, even if you don't get it at the hospital, you can go to the pharmacy to get it with a prescription form.
Okay, all right.
Because some of them forcefully dilate the cervix.
Okay.
And then cause you to abort.
Okay, all right. Let me read a few comments. Yao Labi says that very interesting. Watching you live from Legon. Okay, thanks, Yao Labi. Bennett Techitexi says that would there be any anesthesia before the procedure is performed?
Okay. So should I answer that?
Yes, please, you can.
Yes. In fact, there are two major types of medications or procedures used during an abortion. I'm not here to name medications, but there are two types. The one that we use, the medical method, and there is this machine known as the manual vacuum aspirator. So it is used to suck the baby, and then there's one they give you medication. So with all these things, they give you anesthesia because the procedure is a bit painful. So they give you anesthesia local.
Okay.
To calm your nerves and to reduce the pain before the procedure is done.
Okay. All right. Okay. So, Bridget Amandi says, well, I'm learning. Okay, it's good. We are all learning this afternoon. So, please, Mrs., you can continue.
Okay. So, concerning the minors.
Yes.
So, you are not supposed to deny every minor, no matter how young the person is. The person should visit you, tell you her problems, and then you weigh the person through the educations that I mentioned earlier. So if the person is qualified to have the abortion, you can advise, can you tell your parents about this procedure before it is done? No, I don't want to tell my parents, it's fine. So do you trust anybody, or do you want anybody to be behind you before the procedure is done? If she said yes, fine. But if she says no, she only has to sign the consent form. You explain the procedure to the client, and then you are good to go. There is no way you can deny the client the need to have an abortion.
Okay. And please, before you continue, what's the difference between miscarriage and abortion? Because
miscarriage and hello.
Yes.
It's the same thing.
It's the same thing. Okay.
Yes. Whether you've had a miscarriage or whether you've had an abortion, it's the same thing. The type would tell which type of abortion or miscarriage you had.
Okay.
So it is the same thing. Sometimes people go scan room and then they are given a scan sheet. You've had an incomplete abortion, and they'll be thinking, I didn't do any abortion, but it's the same thing.
Oh, okay.
So miscarriage and abortion is the same.
Okay, all right.
So I think we've exhausted much of.
Okay.
Yeah. So if there are more questions.
Okay, let's look at the implication of having an abortion. Is there any health implications with abortion?
Are you talking about the safe or unsafe?
Both.
No,
let's look at both.
Okay, so with a safe abortion, there is no complication, virtually no complication.
Okay.
You are first given a scan to take for them to know the number of weeks the pregnancy is. then you are given the medication or the vacuum aspiration as such, and you are given medications to combat every infection and to kill every pain. So with that one, unless maybe the person doing it didn't do it well, then you might have perforations or infection, but there's virtually no effects with the therapeutic or safe abortion.
With a safe abortion,
okay,
do you have an age bracket where you can term this group of people, this age group, that okay, you are safe to have an abortion, since you are saying that you keep those information confidential? So if you ask the client whether or not to inform their parents and they say no, you are going by it. So do you have, as a clinic, do you have a age bracket for a group of people that we can say, okay, they fall under a group of people who can practice or can have safe abortion, or it is just open to anybody at all that comes or visits the clinic abortion can be performed?
The fact that you have had your menstruation means you are in the reproductive years, and you've had a pregnancy means you are in your reproductive years. So women in their reproductive age, they are all qualified. Every woman in her reproductive age is qualified to have an abortion, if only she falls within the indications given.
Okay. All right. So let's look at the implications of the illegal abortions.
Okay, so with the illegal abortion, I heard they use so many things: concussions. Some people stick wood into their vagina. People taking a whole lot of medications. People even use grounded bottles or excessive sugar, and then they add it to soda drinks, and then they drink just to abort. So if you have these inside you, one, you can send infection traveling up to your uterus, and the infection can cause blockage in your tubes, your uterine tubes. The infection heals, and then it leaves a scar. Then the scar blocks your fallopian, making implantation or making fertilization impossible for you. And those who go to the quack doctors also, there is a technique for you to use the MVA when you are taking the baby out. It shouldn't touch the walls of the uterus, otherwise it will perforate your uterus. If it perforates, you can bleed and die. And then those who insert a whole lot of concussions and the rest, the concussions might carry bacteria or viruses, you may not know. Then you introduce them into the uterus, then it starts forming gangrenes and decay, meaning you have to take your whole uterus out. You can't have children ever again.
Interesting.
And those who take in grounded bottles, or they end up being taken to the theater for surgery just because they have these bottles stuck in their uteruses, their fallopian tube, their ovaries, and the rest, and it's a whole complication on its own.
Don't you arrest such people when they come with these complications? When they come to the hospital, you just perform?
In fact, when they come, most of them don't speak the truth. The only thing we see is bleeding.
Okay.
And if it's incomplete, we have to go in and help you complete the product of conception.
Okay. All right.
With the inevitable, we said it can be complete or incomplete. And the same applies to most of them come here with bleeding, and you ask what happened, madam, madam, and you can't do anything about it unless there's a complication and you can trace and find out that she did something, or she took in something, or she inserted something.
I think that
they told you they fell.
I think before you perform this legal ones or safe one, I think you should trace and find out what exactly happened to them before performing. Don't you think that is your right as well?
Yes, we do. Okay. We do. We asked some of the relatives, some of their neighbors and co-tenants, and they tell us they were inside, and she called that she was really bleeding.
Okay.
And the first thing is to save the person's life. So if after everything and we find out they have any issues, then we can take it up from there.
Okay. All right.
Yes.
Okay. I think we'll take a few questions from our panelists here if they have, and anyone online as well. So please.
Okay.
Krista, do you have any questions for Mrs. Belinda?
There was one she mentioned and said that it's a missed abortion. The fetus still stays inside the womb. but no blood, no bleeding, nothing. So what side effect does that pose to a lady for such an abortion?
Hello, I didn't hear the question. Are you talking about the missed abortion?
Yes, please. You said it. The
Okay.
fetus still stays in the womb. There is no bleeding and all. So does that not cause any side effects since it's supposed to come out?
That is why I first said that with the missed abortion, you can see that every sign of pregnancy is reversing.
Yeah.
You do not no longer feel that you are dizzy, you feel nauseation or whatever. So you can see that you are no more hearing the baby's kicks.
Wow.
Your uterine size is reducing. So it gives you a clue. If the baby still remains inside, it decays and then it causes a whole lot of problem. So you see a few signs that your abdomen is not growing anymore. It has become stagnant or it is reducing in size. You are no more hearing the fetal kicks or fetal counts. We should give you a clue that maintain a banenka. It's in a hospital.
Okay.
So we will then ask you to take a scan, or we will escort it to see if the baby is still there. If it's alive, fine. If it's not alive, then it means we have to get rid of it.
Wow. Okay. And is there any instance where okay, for that one, is it just a natural thing or it was induced?
No. Most of it happens spontaneous. It was under spontaneous. Spontaneous means there was nothing behind it. It just came.
Okay.
It just happened.
Okay. All right.
Am I clear?
Yes, please.
Yeah, it just happened. With the spontaneous, nothing happens. You don't start with taking any medication. It just happens.
Wow.
Due to a few reasons.
Okay. Thank you.
You're welcome.
Okay, I also want to ask, you were talking about the number of weeks which a person can perform under the legal abortion,
Okay.
So I wanted to ask, you see, I read about the medical abortion, the surgical abortion, and under the medical, some are given pills.
Yes.
So is it safe or is it legal to send the pills home to perform such thing, which the person was given from the hospital?
Was given to take home.
Yes, to perform.
Yeah, sometimes you are asked to take the medication home, and then you come back for review the next day.
Okay.
Are you getting it?
Yes, I'm getting it.
The doctor asks you to go for the scan and knows the number of weeks, and then they give you the medication to take home and then come for review in the morning. That is when they will assess to know. So when you come in the morning, they will ask you, what did you see? Did you see bleeding? Did you see clots?
Okay.
Then they will palpate to know if there are retained products inside or it's complete.
Okay.
So if it was prescribed by a medical personnel to you, then it means there is nothing wrong.
There's nothing wrong with it. Okay,
yes.
So
unless you took it on your own.
Okay. So do you have the number of days you are supposed to go under the to do the surgical abortion or the medical one? The number of weeks if you take the scan.
The number of weeks.
Or any week at all, you can do the surgical. You can choose to go by the medical or the surgical.
No.
Or the medical personnel will choose which one you should go for.
No. We will give you the options. Then we explain the procedure to you, so you can opt for any of them.
So what if the person decides to go by the medical one, knowing that at a stage which it's more dangerous to go by that one? Will you, the medical personnel, allow?
No. That is why we are there. We are there to educate you.
Okay.
The risks and the benefits.
Right.
So you can choose from any of them, but we are supposed to tell you what is right and wrong.
Okay.
But ideally, abortion is supposed to be within the first trimester, from 0 to 13 weeks of pregnancy.
Okay.
It shouldn't exceed.
All right.
So if it exceeds, then it means a specialist has to come inside.
Okay. I'll take another question from Kwame Amo. So, but before that, let me ask this question from our viewers. Okay, Kweku Answer Albright says, great show. Thank you so much, Kweku, for joining in live on Facebook. Bennett Texas said that, so if someone starts abortion and didn't complete it and she comes to the hospital, will she be helped?
Yes. It's an emergency, so we don't even wait for anything. We just start the procedure.
So I think the vision of every hospital or clinic is to save life, irrespective of any complication.
Of who started or who. The only thing is to save the life. So if you come with bleeding, we will ask you, did you take any medication? If you tell us no, we will just go inside and check if they are retained products of conception. If they are retained, we are supposed to help you get rid of them.
So if it is about saving life, what about the baby that is being aborted? Is it not about saving life as well? You are not saving the baby.
Yes, it is the mother's option. I'm not being religiously biased or something here. People have their cultural beliefs, people have their religious beliefs, people have their beliefs and customs, but it is our option, or it is our duty to help save lives and to help mothers. That is why the law has given us these indications to go by. If the woman falls into any of these indications, people might even tell you don't abort, but they are the same people who stigmatize you when they carry this kind of baby.
I think the stigmatization shouldn't be a border. I don't think.
Yes, it depends on every stress. It depends on individuals. If you can take the stress or not, it depends on you.
Okay.
So we are there to help. If we give you the options, you come to us. We give you the option. This is what the law says. This is what is at hand.
Okay.
And you want us to help you, fine. But we are not there to. People come with the intention of having abortion, and we educate them, and they carry on the pregnancy.
Okay.
Yes. So we don't always do abortion or something. Okay. But when you come, we educate you, the good and the bad. We weigh your problems, we weigh your situation. If you can go on with the pregnancy, fine. It is the first option we go by before we even attempt. But most often, it is those who come with the incomplete and bleeding.
Okay. All right.
Yes.
Okay.
That one has already been terminated, so you can't do anything about it.
Okay. Kwame, your question briefly.
Madam.
Yes.
Please, is it educatable to do abortion?
Is it?
Is it wise?
Yeah.
Is it wise to perform abortion?
Is it wise?
I think
I'm not listening.
Yes, say you bet stress or moncoso ye abortion.
So is the advice of what?
Oh, Dabio, abortion. The fact is, if Obiawo facility, we give you the option. You can have a family planning method if you want to spay your kids. But the next time the person comes, with a whole lot of complications, with a whole lot of issues, and we in fact, when they come, we take them through a lot of counseling. So I'm not about not or then abortion. No, you have to take the person through thorough counseling.
Okay.
And yet, if the person is still saying me to me, mommy to me, a whole lot. We read the situation now before we do anything.
I think even so, Obakran or Kase or Person Kunhu, I think the counseling department should handle such issues.
Yes, we take them through counseling to say the BA we can't do anything about it.
Okay. All right.
So yes.
Okay. Any more question, Kwame? Okay, there's no more question. Okay, let me read this comment. Ethel says, "Go girl, thank you so much, Nadus." And Benedict Texan said that please, whenever you visit any hospital, they are to tell you your review date, and if not given, ask or unless otherwise, you are just passing, and the sickness come in urgent. Okay, that's it. And Kwabena Fimpo just sent abortion. Okay, so Belinda. What about the babies that have been dumped in gutters and all that because of this illegal way of terminating pregnancy? What can be done from your point of view, from your angle?
The babies down. Some of them are not there though. So it's somebody came to the facility. The person might ask for an abortion option. Then some of the staffs or some of the people around not trained in abortion will say, "Hey, so she hides somewhere and then abort the baby and lose the person." So we don't want that case, and we don't want the person to try an unsafe abortion and then die in the process.
Okay.
So it is all a complication or an issue concerning this abortion stigmatization.
Okay, but
even if you have incomplete or spontaneous abortion, people think you induced it.
Exactly.
Yes.
Okay, before you give your general advice to the young people out there, I don't think that. Let me ask this question: do you think abortion is the right option for anyone?
I would not say it is the right or wrong option, but imagine someone pregnant and then had aborted and some of the products have been retained. Will you advise the person to continue with the abortion, or just walk around with the baby retained inside? So abortion is sometimes very necessary.
Okay.
Depending on the situation at hand.
Okay.
So it depends on you, the individual.
Okay.
If you think you can walk around with a decayed baby in you, fine. With a missed abortion like this, the baby is no more alive. But you have to go through the process of abortion to get it out. So when you say, because we are abortion and I mean
this is a different. This is a different case. I think the baby is already dead already. So
yes,
yes. Okay.
And I'm saying abortion is not just criminal or induced abortion. Abortion is you're asking if abortion is the right option. So we are talking about abortion in general, whether induced, whether spontaneous. It depends on the individual.
The individual.
Meaning this being the now can't say sorry now sorry. Sorry. Also sorry. It will feel say what sorry say me then you shouldn't come say abortion and you can't continue. Yes. So it's individual based. If you think your culture or beliefs or religious background is
sounds at it.
Yes, you should stick to that one, so that the person who doesn't believe in that too can stick to whatever he or she believes.
Okay, my last question.
So I wouldn't choose sides.
My last question before your advice. So, as part of your counseling package, do you ever tell the patient to keep the pregnancy and probably after birth you give that? You know there are couples out there who also want child to adopt. Do you ever tell them, counsels them to keep the baby and probably after birth you take the child and you take it to the other department that do you ever counseling?
No, we talk them through.
Okay.
That keep the pregnancy. The child might be someone specific in future or someone honorable in future. But we don't decide for you whether to give it for abortion, adoption or so. Yes, we just give you the importance of keeping the pregnancy.
Okay, all right.
Yes,
so Mrs. Belinda Nyame, your advice to every young out there who is listening.
So I'll advise all the women, especially the teenagers, that when you have your menses, it means anytime you can get pregnant. So if you think you are sexually active and you can't abstain, then you should use protective something, which is the family planning or contraception. Family planning is not basically by force using a pill or using a procedure, but you can use your cycle to stay away from sex. If you can't, and abortion is supposed to come in mind, then it should be a safe abortion, not an unsafe one. Thank you.
Okay, thank you so much, Belinda, for coming through. God bless you so much. It's been educating.
Amen.
Enjoy the rest of your day.
You too.
Thank you.
You're welcome. Bye-bye.
Bye. It's interesting. But the best advice is abstinence. Abstinence is the best, because if you abstain, you wouldn't have to go through a lot of medical processing. And now the hospital no quite feel sick, because I hate hospitals. So abstain from it, so that you don't have to be worrying. You don't have to be carrying the burden of terminating the pregnancy. An innocent child. Including say, oh, you're ready to tell your mom. You are not ready to be a mom. Please abstain from sex. But the moment you enter into it, it means that you are ready. So face the consequences. Face your responsibility. Janet Meki, thank you for tuning in. Yes, he says that I came in late, but I'm learning. Yes, it's been educative, interesting. Let me go quickly to Priscilla and Erica. Do you have anything to say? Today's session has been.
I'm just quiet and a bit fun and all that, but you know, she's a medical expert,
yes.
and I understood some of the points she came from, because some of the children or the pregnancies come with a lot of risks. But if the person is in total perfect condition, medical wise, I don't think that should come in. Well, they will talk to you. It's up to you to make your decision. People like Justin Bieber, Tim Tebow, even Steve Jobs, the one who did Apple. Somebody like all these people were contemplated to be aborted, and today they are great people in the world. So who knows what your child would be? Just like the woman said. So
keep the baby. If you are not ready to be a parent, then abstain from sex. I think that's the best advice we can give to the young ones. But if you are married, of course, it's free bonto.
Yeah.
Okay, Erica. It's nothing else. I think today you are sad. Let me answer my question. I said, what is happening in the country that you are saddened or you are not happy about? That was yesterday's question.
Yeah.
So give your answers briefly and shout out.
Sanitation and how it floods all the time when it rains.
What are you doing about it? I'll ask you tomorrow.
Oh,
Erica.
wow.
Okay, Ghanaians fighting each other sake of various parties they belong to.
Okay.
Yeah,
Yes.
election time.
So all right. So I will ask you what you are also doing about it tomorrow.
Really?
I am afflicted all the roads.
Okay. Thank you. Any shout outs? Any shout outs, guys? Any shout outs?
Yeah.
Hi to all that joined us today. God bless you so much, and I hope you did learn something.
Yeah. Okay, Erica.
Okay, and a big thank you to our mother, sister, Miss Belinda.
Mrs.
Yes, Miss.
Mrs.
Hey, Mrs. Belinda. Sorry, yeah. Thank you for educating us. And all viewers to say God bless you.
Okay. All right. Academic here.
Yeah, to my sweet mother Elizabeth Eduamo and Father Kwame Amuteli and Auntie Sadia and the sweet midwife, yeah.
Hey, Ubenya asem na kota po. Obi wife o say sweet. Even nek kasha wasum. Ebe minimum. Osofu peni a. So peni onim sweet. And I mind there. Interesting. God bless you guys for the contributions. Benedict Texting, you've been great. Kabina Frimpong, God bless you. Jeanette, God bless you. Sigismund, God bless you. Ethona Dilate, God bless you. Beku Ansa, Albright, thank you. Bridget Amandi, God bless you. Yao Labi, God bless you. Bernard Vanderpool. Oineba Sampa, God bless you. Ainfonia PC. Richard Azimi, God bless you. Isaac Kwesi Akum, God bless you all for the contributions. To all those who liked, who shared, God bless you. It's been educative as usual, informative. If you just tune in, this is Youth Avenue, the Lunchtime Show here in the studios of Premier FM. Youth Avenue comes your way every Monday to Friday from 12:30 to 2. Make a date with us all the time. Tomorrow is Rep Your Day. Rep Your School. Rep Your School on Youth Avenue. The entertainment side of Youth Avenue, but at the same time educational. Benedict Texas says that Kwame Amu, I feel you pass. Pacho Oye Bema. I hope there is no When you're Bema, Benedict says that you're fellow. Interesting. Bennett, feel me too, eh? My name is Na. You can feel me. Okay, Kwame Amu so fellow Bennett. Also Oya down mom. Interesting. Today has been a Thursday, a beautiful Thursday, the 29th day in the month of October in the year 2020, and you've tuned in to Youth Avenue, dedicated informative, entertaining talk show in GL with God's own, God's favorite line. Before we go, remember, if you want to sponsor Youth Avenue or any other program, Brunch Show Mid-Morning, Asadakwan Soul, Sabbatarian, Premier Kickoff Sports, the current our political show, Flashy Dice, and any other program, Salvation Hour. You can call Premier FM on 0244627930 or 0244627931. And for all your advertisement needs, come on board, let's grow the brand. Premier FM, the best online radio so far, will meet your expectations, will deliver, more than deliver. Come on board, let's advertise your products, your goods and services, because we'll do justice to them. Do me a favor, you can still share this video, this show to your friends, Let them be educated. Let them be informed by the right information. Because there are so many informations out there. If you don't place yourself under the right information, you'll be influenced negatively. So do me a favor, share to the world. Let's educate the world. Time check, 58 minutes past the hour 1. And you are still tuned in to Youth Avenue, the Lunchtime Show. Before we go, let me acknowledge our director, Nanedu Asante. God bless you. Our executive producers, Mr. Samuel Asante Nuro and Nanedu Asante. God bless you for producing us and believing in us. And to our line manager, Ebenezer Jemfi, attached but can mingle. And also to my DJ today, DJ Darling. God bless you. And to my producer, Ajua the Great. God bless you. The only woman in sports. And to our programs manager, the boy. And to the rest of the team, Priscilla, the sweet voice, Erica, the Premier FM Bruni, and Kwame Mo academic year, and the love doctor. And to myself, Line I call God's own, God's favorite. I'm Funya Kechi. Thank you so much. I appreciate you all, the viewers, our cherished listeners. Keep on listening, keep on watching Premier FM because we have power-packed programs. Stay tuned, stay. Don't go anywhere. Don't touch your phone. Don't touch the dial. Don't change the channel. Keep on listening to Premier FM. Premier FM, power to the nation. Time check exactly 2. And up next is Salvation Hour. Salvation is key. It is important. Make sure you have Christ. Alright, let's do this same time tomorrow, 12:30 to 2. Make a date with us. And I promise you it's going to be educative and informative as usual. Thank you so much. Have a blessed day. Enjoy the rest of the programs.
Allah